Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us talk about how to go ahead before doing an IVF in a patient of Asherman syndrome. Now, what is this Asherman syndrome? Many patients have their uterine walls stuck up to each other, and it is a complex situation which is called as Asherman syndrome, in which there are adhesions, or there are the complete walls of the uterus are all stuck up to each other and the function of the uterus is deranged. So basically, whenever we are suspecting a patient having Asherman syndrome, the lady typically complains of no bleeding during menses, just spotting during menses, no menses without having medications, and at certain times in very young age, in spite of having good hormonal status and normal sonographies, the patients don't bleed at all. This is a sign that the uterus function of the inner layer, which is known as endometrium, is stuck up to each other, and hence it can be a potential problem for a patient of infertility. So in suspected cases of Asherman syndrome, we go ahead and do a hysteroscopy, which is a diagnostic as well as a see and treat. That is, after the hysteroscopy, all the adhesions which are present in between the wall of the uterus are all removed artificially with the help of lasers or cautery, and a proper area in the inside of the uterus is made so as to hatch the baby inside after the embryo transfer. So before doing IVF, if we are seeing that the endometrium is not good, or if the size of the uterus is small because of Asherman syndrome, it is important that it is treated first. We wait for 1 or 2 cycles and then only start the test tube baby treatment. So if you are a patient who is suffering from very low menses in quality and quantity, please do not worry. You have to see your IVF physician and just confirm whether you are a patient of Asherman syndrome, get yourself treated, and then only start your IVF cycle. Thank you.